There is a risk of diabetes even in the kids. What are the kind of foods? What are the kind of food a parent should be looking at to give to their kids?
The risk factors for diabetes are many. It could be genetic, it could be your lifestyle, or it could be multiple other risk factors.
I mean, how do we know if a kid or a child or adult is affected by this? Are there any symptoms that is seen?
Some of the symptoms are classical, and to describe it, there are something called as 3P. Instead of giving pizza, burgers, give dosa, chapati made at home, and instead of playing football on the mobile, send them to the field outside.
Right, so I'll come to the interesting part of this and the last question. Can the diabetes be reversed? Namaste all, welcome to the Samvada podcast. Today we'll be talking about the most discussed topic ever in India, that is about diabetic. Today we have with us Dr.Surekha B Shetty. She's a diabetologist. Let us hear from her as to what are the causes for diabetes. We also see that there is an increase in diabetes every now and then here in India. So let us find out from her the reasons. Namaste doctor, welcome to the show.
Namaste.
So we've been hearing about diabetes every now and then, and it is also said that India is one of the diabetes capital because there are so many people who are suffering from this. So what is this exactly? I mean, is it just because of the sugar that people suffer from this, or what is it? What diabetes is first and foremost?
Diabetes, as you can see, is one of the most common chronic diseases worldwide. And when I say chronic, it means it's a long-term disease. So by definition, diabetes is a state of increased blood sugars. That means the blood sugars are above the normal limit for that person's body. And this is caused by defect in insulin production, insulin action, or a combination of both. Diabetes is manifested by various symptoms that could be detected through blood test and treated accordingly.
Okay, I'll come to the blood test part. We never used to have, these complaints that we have today. We were never the capital of cholesterol. We were never the capital of diabetes. Now that everything is coming, do we have a thing that we need to be concerned about?
Of course, diabetes is a lifestyle disease. As we are facing an era of modernization, we are seeing a lot of change in the way we eat. And that definitely is increasing the risk of chronic diseases, more importantly, diabetes. The risk factors for diabetes are many. It could be genetic, it could be your lifestyle, or it could be multiple other risk factors. But probably in a simple term, we could say that the food that we eat, the air that we breathe, and the water that we drink, everything is adding to the risk factor and increasing the risk of developing diabetes.
So what you're saying is the food that we had before is quite different from what we are having right now. And it also, the drinks that we drink, for example, earlier there were no health drinks that we call today. So, and then that is also causing juvenile diabetes. Don't you think so?
There are different types of diabetes, and juvenile diabetes, what we call as type 1 diabetes, is an entirely different disease. And the lifestyle disease, what we call, is more of type 2 diabetes. Okay. Type 2 diabetes is related more to the body weight, the physical inactivity, unhealthy food that we take. And so possibly all the carbohydrate rich processed food that we take, and also the sugar rich products that we consume is adding to the risk.
Okay, now we'll come back to the testing part. Now, how do we go for a test? I mean, how do we know if a kid or a child or adult is affected by this? I mean, are there any symptoms that is seen?
Yes, of course. The first scenario where diabetes is tested for is when a person has symptoms of diabetes. Some of the symptoms are classical, and to describe it, there are something called as 3P. Okay. What is 3P? Polyuria, polydipsia, and polyphagia. Okay. So what is polyuria? Increased urination. Okay. Polydipsia is increased thirst, and polyphagia is increased hunger. So these have been called as classical symptoms of diabetes, but not every patient has these symptoms. So apart from that, it could be weight loss, tiredness, burning sensation in the hands and feet, blurring of vision, increased risk of infections, and poor wound healing. These are some of the common symptoms that usually bring a person to the hospital for checking for blood sugars, but it is also noted that many of the subjects are found to have diabetes without any of these symptoms and on routine screening. And that is why it is said that we should not only wait for symptoms in a patient who has high risk of developing diabetes, like a person who has strong family history of diabetes, who is overweight and obese, who eats a very unhealthy food, who is physically inactive, who smokes, who has high cholesterol. All these people should test for their diabetes once they cross 40 years.
Right. So this is for the adults.
Yes.
And does it mean that in case if he finds all the symptoms, it is only the, diabetic positive, or is it just any one of the symptoms?
No.
Maybe he's feeling thirsty, but then he's not urinating very often. So how does it?
Yes, these are some of the symptoms, and there could be many of these symptoms, one of the symptoms, or even none of the symptoms, as I told you. But yes, the probability of finding an abnormal sugar increases when you have any of these symptoms. And that is why the recommendation is that once you cross 40, get your sugar, cholesterol and blood pressure checked, irrespective of whether you have any symptom or not.
What is the recommendation now? I mean, what should be sugar levels in a healthy individual? Let's say with no complaints of sugar, what should be the parameter? What is the parameter?
Normal blood glucose values are described by 3 parameters. First one is fasting plasma glucose, which should be less than 100 milligram per dl. Second one is postprandial blood glucose, which is done 2 hours after eating food. It should be less than 140 milligram per dl. And the third one is HbA1c. This is a special test which tells us the average of last 3 months, and it will be less than 5.8. In a person, we can diagnose diabetes when the blood sugar levels are above these numbers. But to quantify accurately, fasting plasma glucose more than 126, postprandial more than 200 and HbA1c more than 6.5 is diagnostic of diabetes.
So when you say post meal and 125 is before the meal.
Yes.
And up to 200 is post the meal. I mean after having food.
Yes.
Right. Okay. And the other one is the 3 months average of 3 months. Okay, that is 6.5. Right. Okay. So it is also heard that during pregnancy there is a vary in sugar level. So what is it? I mean, is it for lifetime or how is it?
If you look at diabetes, there are different types of diabetes: type 1, type 2, gestational diabetes and other specific types of diabetes. Type 1 is that we see in children and is primarily insulin dependent diabetes. On the other hand, type 2 diabetes is something that we commonly see in adults and is more controllable with tablets and lifestyle modification. Third variety is gestational diabetes. It is a type of diabetes that is first recognized or develops during pregnancy and subsides after delivery.
Okay, so that's not the regular one. I mean, you don't have to.
Probably you could say that it is a harbinger of future type 2 diabetes. So a woman who is found to have diabetes during pregnancy is at a higher risk of developing type 2 diabetes at a later life. And that is why after delivery also we recommend the women with gestational diabetes to regularly check her blood glucose levels.
So what do you suggest? I mean, in case of any of these type of diabetes, what are the treatments do you recommend?
Diabetes is, as I told you, a lifestyle disease, and there are 4 important pillars of management of diabetes. The first one is diet, second one is exercise, third one is medication, and fourth one is regular blood tests. So when you speak of a diet, diabetic diet is just a healthy diet which focuses on less sugar, less oil, more vegetables and in moderate quantities. So eat a healthy food on time and in moderate proportion.
When you say moderate proportions, is there any quantity that one has to eat, or is it that we are getting too deep into it?
Yes, the amount of food is individualized on the basis of physical activity, body weight, age and other blood parameters of a person, and probably it can be charted out with the help of a nutritionist where more precise way of eating can be followed.
So what you recommend is cut down on your carbohydrates, as
Yes.
in less carbs.
Yes.
Right. Okay.
And when you talk about carbohydrates, again we should understand that there are healthy carbohydrates and unhealthy carbohydrates.
Like good cholesterol and bad
Yes.
cholesterol.
So complex carbohydrates are preferred way of eating a food. Like for example, wheat and maida. So what happens to maida? It is more refined and hence it is digested faster and increases sugar faster, and that is why it is to be avoided. So complex carbohydrates come with high fiber content and hence it is digested slowly and increases the sugar much smoother manner. Second component is physical activity. Being physically active is a very important component of diabetes management. The recommendation is that at least 30 to 60 minutes of moderate intensity physical activity at least 5 days a week. It could be any form of exercise that is easy, that is sustainable and followable by any person.
Walking in the morning.
Yes, brisk walking is as good as any other form of exercise, but consistency is the key. And apart from reducing the blood sugar, it also helps in reducing the body weight, reducing cholesterol, improving heart health, muscle health and so many other benefits which comes at a zero cost. Last component of diabetes management is medicines. Obviously, this needs to be done under medical guidance. There are multiple medicines that can be used for management of diabetes. In type 2 diabetes, it is primarily tablets in the initial phase. Over time, different dosages of multiple drugs might be used. But in type 1 diabetes, insulin is life saving. Since it is diagnosed in children, parents find it frustrating to give insulin injections to the children. An important message for these parents: as of now, type 1 diabetes is treatable only with insulin injections apart from healthy food habits, and skipping or substituting insulin injections with any other treatment form can be dangerous and life threatening and could lead to a condition called as diabetic ketoacidosis. This is to be avoided at any cost.
What do you recommend a kid to be having? I mean, because there is a risk of diabetes even in the kids. What are the kind of foods? What are the kind of food a parent should be looking at to give to their kids?
This is a very important question because a healthy child grows up into a healthy adult, and the foundation for future health begins in the childhood. So, to put it in simple forms, instead of giving pizza burgers, give dosa chapati made at home, and instead of playing football on the mobile, send them to the field outside. So, healthy food habits are simple, they are homemade, they are made using the locally available and sustainable products and made with healthy oils and other components. So, as I told you, carbohydrates are something that we need to pay attention, and coming to proteins and fat, again they should be healthy, and the options are available, plant based and multiple things that can be cooked at home.
And also, is it better to avoid soft drinks or that energy drinks that crazy ads comes?
Yes, absolutely. If you look at the carbonated drinks, they are sugar loaded, and the more you drink, sugar is addictive, and the more you drink, obviously it leads to influx of glucose into the body, leading to obesity, and the risk of chronic diseases increases.
Talking about the complications, what do you think? What do you think is the complication here in somebody being diabetic?
The concern that people have when they are labeled as diabetic is not just the current management of diabetes, but also the risk of complications. Presence of high blood sugars in the long term can lead to multiple complications. At the current situation, the patient can have high risk of infections, poor wound healing, blood vision and so on and so forth. But when this sugar is left untreated or uncontrolled for a long time, it can affect all the organs in the body from top to bottom, and we go by the term called as pathies: nephropathy, retinopathy, neuropathy. So what do I mean by that? It can affect our eyes and damage the retina, which is called as retinopathy. It can obstruct the heart blood flow and cause coronary heart disease. It can reduce the function of kidneys by causing nephropathy, and also the damage the nerves and cause neuropathy. So these are the important complications of diabetes which can lead to a lot of morbidity and mortality in people with diabetes.
So it is also believed that consuming this diabetic pills for a long time also will damage your kidney. So is it true or is it a myth?
This is an absolute myth. High blood sugars can damage your kidneys, not the medicines used to treat it. On the other hand, when you take your diabetic medicines and bring your blood sugars down, the risk of developing kidney disease comes down. That is one component of it. Second component, the medicines used routinely in medical practice for controlling blood sugars are all tested under stringent clinical research methodologies, and they are approved only after their safety and efficacy has been proven. So the important safety parameters is on the heart and the kidney. So it is definitely established that they don't have any side effects on the internal organs, and diabetic medicines are one of the safest medicines around.
Right. So I'll come to the interesting part of this and the last question. Can the diabetes be reversed?
Reversal of diabetes is a layman's terminology which people use when they are able to stop their medicines. But when you look at the actual meaning of reversal, it means that the disease has been completely cured. But can we use this term for a chronic disease like diabetes? The answer is no. Hence, remission is a better terminology used, and what does it imply? The blood sugar control has been achieved without the help of medications. That's about it. Can we do that? Yes, there are methods to do that. Low carbohydrate diet and bariatric surgeries are the two important methodologies, and low carbohydrate diet is the one that is highly promoted in the current era. But you should remember that when we talk of low carbohydrate diet, here we are using a very low content of carbohydrates, and the calorie intake also is reduced significantly, and hence that type of diet is very difficult to follow on long term. So who are the people who can achieve remission with this kind of diet? There are few parameters. One, a young patient. Second, duration of diabetes being short. Third, the body weight is high. Fourth, the blood sugars are not very high. Fifth one, a person whose pancreatic function is still good. Of course, even in this patient, the remission is almost possible in certain section of people and for a short duration of time. Hence, we should not get carried away by this aspect and keep a watch on our blood sugars. But yes, the low carbohydrate diet, when followed in a correct scientific manner, can avoid use of medicine for significant time, and if not, it can at least bring down the dose of medicines. Diabetes is a long term management issue, but when managed well, you can live a healthy and long life with diabetes. Consider it as an unwanted, uninvited guest. You have no choice, make friends with it, take good care of it, keep it under control, it will never trouble you.
Right. I thank you so much for coming here and taking out your time, educating us and our viewers. I thank you for all the insights. Thank you.
Thank you so much.